Welcome to Sri Ram Medical College. Today we will explore dialysis technology for children, ensuring safe and effective treatment. Technology advancements and the shift from minimal/adequate to optimum/maximum dialysis prescription have contributed to a 20-year improvement in pediatric hemodialysis practices. Dialysis is a life-saving medical treatment for children who suffer from chronic kidney disease, CKD, or end-stage renal disease, ESRD. Dialysis technology has evolved significantly over the years, making it possible for children to receive safe and effective treatment. However, dialysis is a complex process that requires specialized equipment, trained personnel, and careful monitoring to prevent complications. Kidneys eliminate waste and excess fluid. Certain diseases damage kidneys. Waste materials clog the body. There are two types of dialysis technology used for children: hemodialysis and peritoneal dialysis. Hemodialysis is a type of dialysis that involves the use of a machine to filter waste products and excess fluids from the blood. In hemodialysis, blood is removed from the patient's body and circulated through a dialyzer, which is a device that removes waste products and excess fluids. The blood is then returned to the patient's body. Hemodialysis can be performed in a hospital or dialysis center. Peritoneal dialysis has the benefit of allowing your child to continue with their regular routine, including attending school. Recently, home hemodialysis program has been launched that will make it possible for children to continue their education despite their condition. However, this does necessitate training for the carers involved in home dialysis of any kind, as well as a thorough understanding of how your child's weight affects fluid balance and blood pressure. You must report to the ward for at least a week of training. Naturally, you can call us from the comfort of your own home if you have any worries or questions. Not all children are candidates for peritoneal dialysis. Adhesions between the guts loops after previous abdominal surgery may prevent fluid from freely flowing through the abdomen, reducing the likelihood of a successful procedure. Peritoneal dialysis, on the other hand, involves the use of the patient's peritoneal membrane to filter waste products and excess fluids from the blood. In peritoneal dialysis, a catheter is inserted into the patient's abdomen, and a sterile solution called dialysate is introduced into the peritoneal cavity. The dialysate stays in the peritoneal cavity for a period of time, during which it absorbs waste products and excess fluids from the patient's blood. The dialysate is then drained from the patient's body, and the process is repeated. Hemodialysis and peritoneal dialysis both have their advantages and disadvantages. Hemodialysis is generally more effective at removing waste products and excess fluids from the blood, but it requires the use of a machine and can be more time-consuming. Peritoneal dialysis, on the other hand, is more convenient and can be done at home, but it may not be as effective as hemodialysis. Dialysis is a complex medical treatment that requires specialized equipment, trained personnel, and careful monitoring to prevent complications. The following are some of the measures that can be taken to ensure safe and effective dialysis treatment for children. Dialysis equipment is specialized and designed to meet the unique needs of children. Pediatric dialysis machines are smaller than adult machines and are equipped with features that allow for precise dosing and monitoring. Additionally, Pediatric dialysis machines are designed to be more comfortable and less intimidating for children. This is important because children who are comfortable and less anxious during dialysis treatment are more likely to comply with the treatment regimen. Dialysis treatment for children should be administered by trained personnel who have experience working with pediatric patients. This includes nephrologists, nurses, and other healthcare professionals who have specialized training in dialysis treatment for children. The healthcare professionals should be able to monitor the patient's vital signs, adjust the dialysis machine settings as needed, and respond quickly to any complications that may arise. Regular monitoring is essential to ensure safe and effective dialysis treatment for children. This includes monitoring the patient's vital signs, blood pressure, and fluid and electrolyte levels. Regular blood tests should also be performed to ensure that the patient's blood chemistry is within normal limits. Additionally, the dialysis machine should be monitored closely to ensure that it is functioning properly and delivering the correct dosage of dialysate. In order to pass the cleaning fluid into and out of the abdomen during peritoneal dialysis, abdominal access is necessary. Our transplant doctor accomplishes this by inserting a soft catheter through a tunnel in the skin, into the abdominal cavity, and out the pelvic area. When not in use, the other end is capped off to prevent any contamination from occurring. As a general rule, we wait at least 3 to 4 weeks before beginning dialysis to ensure proper healing. This is because the sugar in the dialysis fluid injected into the abdomen causes the fluid to leak out if the tunnel under the skin has not properly healed. In this case, the catheter's sugar and plastic can lead to a very difficult to treat infection, tunnel infection. You and your kid will have to visit the ward once a week until we're ready to begin dialysis. Our clinical nurse specialist will have your child lie on a couch and will hang a bag of cleaning fluid so that it can run into the abdomen through the tube. The term for this procedure is catheter flushing. The bag is lowered, allowing the fluid to run back into the bag on its own. Issues with catheter drainage are possible. It's crucial that your child avoid constipation, as this can force the tube out of place. Healthy eating is an integral part of your child's care. Changes in your child's diet may have begun even before dialysis treatment began. Your dietitian will keep in touch to discuss your child's progress and any dietary adjustments that may be warranted. Some children who only produce small amounts of urine need to limit their salt intake because it causes them to become overly dehydrated. High blood pressure will result from the retention of salt and water. However, infants and young children who urinate frequently may benefit from additional salt. B.VoC in dialysis technology eligibility criteria. 12th class from any recognized board. Students, arts, commerce, science, of any age can apply. A minimum score of 50% in the 12th class. Join Sri Ram Medical College's Bachelor of Vocation and Master of Vocations in Dialysis Technology and take the first step toward a successful career in hospitals. We're here to assist you in launching your medical career. Call us at 9968193009 for more information about our program or to submit an application right away. Sri Ram Medical College, nurturing next generation of healthcare leaders and offers all paramedical, pharmacy, nursing and yoga sciences courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.